Sure, my name is Consuela Cruden. I am an OBGYN coming from the United States. I have practiced OBGYN or conventional OBGYN for over 10 years in West Virginia, in Martinsburg. Well, when I found myself interested in pursuing more knowledge and really expanding my practice in cosmetic GYN, I realized that in my area there was very little known and very little support and resources available for training in aesthetic gynecology. And actually it's frowned upon in most of our organizations to actually have this vision of how to support patients and how to approach patients when patients approach you with a desire of wanting to feel better. It's very important not just looking at aesthetic gynecology as something that is beautiful and something that will just fulfill the woman's desire, but we oftentimes find that if women feel better about themselves, they're more productive in the society. They're better in their families, they're just more productive individuals as a whole. And with having built my practice for 10 years and having built patients that I've actually seen growing through my practice and now having different desires, I felt that I had to also support that. Absolutely. I think my approach to doing anterior and posterior colporrhaphies, anterior-posterior repairs, and vaginoplasties will immensely, with what I've learned today, improve what I want to accomplish in my repairs, from a more aesthetically pleasing, making the patient happy about her procedures. That will definitely benefit both myself for my satisfaction and for the patient, who would most likely be very happy with the results. And also it'll, what I've learned in this course will benefit me greatly in my obstetric practice. The next step, which I anticipate will be the most important step for me and maybe the more challenging step for me, would be how to incorporate what I've learned in my already established practice and then how to grow it from here on.